Hi, good afternoon. It's a pleasure to have you on the podcast, Next Level Discourse. Dr. Adewunmi Akingbola. Most of us know you as Dr. Tesla. It's good to have you here with us.
Yeah, all right. Thank you very much. Thank you very much for the invitation. I'm also excited to be on the podcast finally.
Yes, that's great. Let me start by congratulating you on your recent award, being named among the 100 Queen Elizabeth Trust Award. Congratulations.
Yeah, thank you very much. Thank you.
Yeah, that is really exciting. Can you just briefly walk us through the path and some of the things you've done that has positioned you for this award and quite a number of awards you've won in recent months or years?
Yeah, all right. So one of the very first things that I would love to highlight that I think improved my position in with regards to attracting national and international awards is my sincerity of purpose. Now, sincerity of purpose is not a phenomenon. It's just something that I think I coined out of just subjectively analyzing different applications that I have done and looking at the ones that I was successful on versus the ones I was not successful on. So I define it this way, that sincerity of purpose is when you are able to show a very clear link between everything you've done and between where you are going. So, for example, I studied medicine in Lagos State University, Nigeria, and as a medical student, I realized that Lagos and Nigeria more broadly has very high prevalence of viral hepatitis B as well as other infectious diseases. But I decided to emphasize on viral hepatitis B. And so since then, I created a non-profit project and then we started to create awareness. From creating awareness, we started to do free hepatitis B screening. And then from there, we transitioned into doing subsidized hepatitis B vaccination exercises. And so from doing that, I, even as a medical student, I also did some internships, for example, at the Lagos State Biobank, where so interestingly, when I was doing my Lagos State Biobank internship, we had the dual outbreak of Mpox and Lassa fever in Lagos State. And so I worked with top public health professionals, including members of World Health Organization within that period to sort of stem the tide or cut the transmission rate of both infectious diseases. So if you look at my entire career so far, there is a very clear link between studying medicine, running the non-profit project, and including the master's programs that I did at the University of Cambridge. And what the common theme that you find across all of this journey is my passion for infectious diseases, epidemiology, and global health equity. You understand? And so because there's that clear linkage, it is easy for people to see that this guy is sincerely interested about creating awareness about this discourse and about championing advocacy strategies for infectious disease. And it's easily just positions me and just places me at the center of several opportunities. You understand? So, and very importantly, I must also emphasize that building a sincerity of purpose profile basically takes several years. You understand? So, but the one thing I know that I ensured to do was I discovered a problem. I was very interested and passionate about creating awareness and, in my own little capacity, solving the problem in my community, and that has translated into so many things that I have gotten today. Thank you.
That is quite interesting. And I think we've gone past the phase where people just see certain awards and they desire to just win the awards, or people see certain positions and they just desire it and just go for it. From what you've shared, it's important that we are actually doing something intentional along that line. So we are not doing it for the awards, but we are doing it for the sincerity of purpose and for the sake of providing a solution to a particular problems. And in that, we are positioned to win those awards. That's quite interesting. Can I also, just a follow-up question to that, in positioning yourself for these things you're doing, particularly for HealthDrive Nigeria and the campaign about infectious diseases, the vaccination program, and the screening program, what has been some kind of challenges you faced? And for people who are trying to tow this path as well, what is that challenge, or what is a common challenge that one could face in this kind of initiatives? And how have you been able to, overcome those challenges in recent years in the initiatives that you've been doing?
Yeah, all right. I think that is a very good question, because I understand that not everyone will have the luxury of knowing exactly what to do at varying points, especially the fact that when I was a medical student, I knew that this was exactly what I wanted to do, and I started it, and I went on with it. So I know that many people have that challenge of identifying what they want to do and tailoring their career trajectory in that line. So, and interestingly, that was also my first challenge. You understand? So when I discovered the hyperprevalence of viral hepatitis B in Lagos, in the medical school that I was in then, I didn't know what to do exactly, because I looked around and I did not see any advocacy project about it. I saw several about HIV. I barely found any advocacy project for hepatitis B around me. So that was what made me to say, okay, do you know what? I am a medical student. I have the knowledge base, and as I joined into medical school, I would have the skills also. I think I should be able to develop and lead an advocacy project in this area, since I have seen the hyperprevalence, and I also see that there is very little awareness about it. So that was my first challenge. So setting up the project, setting people up to work with them was the initial challenge. And so based on that, I would advise people to not necessarily have to start their own project, because starting a project means that you are going to be the central leadership person in the project, and it would not be very easy, because you would also need funding to run projects. So what you can do is you can join several projects that are ongoing in several organizations, and if you work hard enough, you can hold very good leadership positions in those organizations. But make sure that every project you want to get involved in, every organization you want to volunteer with or work with, it has to be in line with that particular area that you want to tailor your career trajectory along. Because if it is not, it may not necessarily count for you. Because so maybe at a later part in this podcast, I'll talk about fits. You get, but for now, my first challenge was getting started, and after getting started, my next challenge is what everyone would anticipate, which is funding. And so what I did was, the first advocacy and free screening project that we did, I had to gather money from my friends, from my family, and including my own personal funds, and then we carried out the project. And that was when I knew that I cannot continue this way, because else, I mean, I was from a low socioeconomic background, and then using the very little money that I had to then fund project was not looking sustainable at all. So what I decided to do was I decided to leverage partnerships. So I looked around, I saw that we had religious bodies, we had corporate organizations that also did not know about viral hepatitis, and I saw that they would like to get their clients, their members, or groups of people screened. So what we started to do was started to present the initiative to them, and told them that if they provide us this so amount of money, we'll be able to conduct a free hepatitis B screening for all of their members or their customers, and also provide subsidized vaccinations. And on the vaccine side, I also leverage partnerships with key non-governmental organizations that steps down the cost of the vaccine. So we're able to continue our project solely based on partnerships. Understand? So those were the two major problems that we encountered. But for the general purpose of this podcast, I really want to encourage people, or generally young people that would be listening to this, that it is okay, it is totally fine to sometimes feel very clueless, about taking that first step. But the most important thing is you have to take that first step. So no matter what you do, no matter how you do it, you have to take that first step. Get into a project, get into an organization that is in line with that particular area of focus that you are really passionate about, and do very good work with them. Thank you very much.
Yeah, that is quite interesting. And personally, I can also share an experience on that. When I was working as a lab scientist in Lagos, I was working in a clinic specifically for HIV and tuberculosis program, and we are quite keen on testing and screening, treating for infectious diseases, but the focus was on HIV and tuberculosis. And then I had, having to attend to patients, having to conduct hundreds of tests daily. You get a massive turnout of positive results, and people test positive for HIV, for hepatitis, for syphilis, and it's like you are in the world there, just in a small clinic or in a lab doing the test, but you're seeing tons of positive
many
results. That is a problem that you've identified, that there are many people living on the streets with this infectious diseases.
And they have no idea.
And some are diagnosed late.
Exactly.
And we can tell, like, the impact of a late diagnosis on how the immune system reconstitutes to defend against these infectious diseases. So early diagnosis is also very important. And at that time, I was also attending a big church in Lagos, and I was part of the Christian Social Responsibility, CSR.
Yeah.
So there was this 1st of December, it's World AIDS Day. And I just told the CSR that, can we just have a program? This CSR, like, you have these big men who, funds the program, funds initiatives, welfareism for people in the communities, students going back to school. And I just told them, like, can we do free HIV testing on the 1st of December? It's World AIDS Day. And he said, yeah, sure, that's a wonderful initiative. I was a lab scientist then. So the church could provide the crowd. They did the publicity for it, that we are doing free testing. There will be foods provided. There will be incentives provided. They encouraged people to come out. And I also spoke with my clinic, because my clinic had an affiliation with the then HAPIN, that's AIDS Preventive Nigeria. So about doing free HIV tests. And the first question was like, how do you do community awareness? How do you get the crowd? I told them, don't worry about the crowd. I'm sorting that out with, the CSR I belonged to. So they provided the kits for free. So I've gotten the crowd, I've gotten the kit. And another issue was, how do we identify personnel that will work? Because it's like testing over hundreds of people. And I just went to the church and I just announced, if you are a lab scientist, or if you're a nurse, if you're a doctor, and you're able to volunteer with the church for a specific outreach program, just indicate interest. And we had a lot of professionals who came up to say, yes, we're willing to do this. So I was able to get resources from the clinic I work, get the support from the church, get personnel also from the church, and we did that amazing program. And I never spent 1 naira from my own pocket to do that. The church saw it as an avenue to do evangelism, outreach.
Exactly.
The clinic saw it as an avenue to encourage their funders, APIN, that they are doing free HIV testing. And that was just it. So just as you've mentioned, leveraging the networks is very important. You don't have to be overwhelmed by the responsibility of the financial commitments, the human resources, build networks. And it's also very important for what we do on HealthDrive Nigeria as well. We did free hepatitis B screening and testing nationally across several local governments in Nigeria. And we have lots of amazing programs like that. You're solving these problems and it's positioned you for opportunities. Just to add this question, how do you now, with all of these that you're doing and the multiple awards you've won, how do you think that positions you, or that positioned you for example, the scholarship you got for your master's program here at the University of Cambridge? For those who are, thinking of, going through these initiatives and for a specific purpose of applying for grants, you could say, or for fellowship opportunities or for scholarships, how were you able to navigate positioning those awards, profiles you have, and using that for some of the opportunities you've gotten?
Yeah, so I think this is also a very important question that needs to be answered, because there are a lot of misconceptions around getting scholarships out there. Now, there is one undeniable fact that academic excellence is needed. You understand? So no matter what anyone tells you, no matter what I say yet today, the number one very important factor that really influences whether one will get an admission offer or a fully funded scholarship is academic excellence. So you have to make sure that you do your best to finish with a good result. Now, if you did not finish with a good result, there's still a very significant hope. And then, so what I have seen is that admission bodies want to see one thing. They want to see evidence of excellence in any area. For many people that are incredibly talented academically, they can show that evidence of excellence through their academic results. But for some people that are not as talented as some other people, you should do your best to show that evidence of excellence one way or the other. Now, for me, I'd like to think that I could easily show evidence of excellence through my extracurricular activities. Now, when I was applying, of course, I did not frame it as extracurricular activities. I framed them as real-world activities, which, in the real sense, everything, so many things we do in academia is actually to have real-world impact. You understand? Vaccines are researched and developed in academic institutions, but has real-world impact. We do medication research, clinical and pharmacological research in academic institutions, but they have real-world impact. You understand? So at the end of the day, if you have fair academic result and you have solid real-world impact track record, I think that is an evidence of excellence also, which is the ultimate end of a supposed academic activity. You understand? So for me, that was my avenue to show evidence of excellence, and I did. And I think it can also work for every other person. For some people, their research capacity is their evidence of excellence that they show. Some people would have published several papers. Some people would have worked as research assistants, work as researchers with research groups and research labs. And then through that, they are able to show the evidence of excellence despite not having having first class or distinction grade results. So for me, when I was applying to the University of Cambridge for my master's program as a final year medical student then, so I made sure that I met the minimum academic criteria, and then I made sure that I talked about what I had done in the real world. I talked about our initiatives through HealthDrive Nigeria, the screening we do, the vaccinations we do, and then I also talked about some of the awards that I had gotten, not to brag, but to show that I have attracted independent validation for the work and the impact that we've done through HealthDrive Nigeria. And so what I essentially did was I essentially tied everything together. I tied the fact that I was studying medicine. I tied it to my interest in public health and infectious diseases epidemiology. I tied my works through HealthDrive Nigeria to infectious disease epidemiology. I tied the fact that I wanted to do an MPhil in population health sciences to get data and analysis skills and experience to be an infectious disease epidemiologist. And I tied every single thing to the fact that I want to work as an infectious disease epidemiologist in the future. Do you understand? So if you look at everything, you see that everything I had done is related to infectious disease epidemiology, and I followed that route, and I started following that route years before I applied. So that easily positioned me for the master's degree offer that I got and the funding that I also got. And so summarily, what I will say is this: whether you have excellent academic results or not, please try to match what you've got with real world experience, real world impact. You understand? Because I think it makes you a lot more competitive than you'd expect. Thank you.
That's very interesting. Connecting multiple dots. So it's a lot of processes with the community initiatives. And one thing you also mentioned is the research aspects, getting involved in publications, relevant articles. We'll come back to that another day. And I think there are quite a lot of things it would be interesting to have you on the podcast to share. because I just to call you out here. I remembered, was it some time ago, less than 2 years ago, I was just looking at your Google Scholar page, and I was looking at the number of citations you had then. I think it was just a bit less than 100. And within months, within just a little over 12 or 14, 16 months, I think I was looking at it, was it last week, and I saw over 500 citations on your Google Scholar page. And this is one of the things that are relevant, especially if you're applying for fellowship opportunities or for postdoctoral positions. They want to see how involved you've been in publishing relevant articles in very strong journals. So that is also another important aspect that needs to be considered as well. So there are multiple dots that should and can be connected, and it doesn't just start all of a sudden. Some people start, like you've mentioned, you started this from your undergraduate days, and that is like definitely more than 3, 4, or even 5 years ago to arrive at where you are now. So it's like it's a long process. And just to continue, or in a few minutes, we're putting a call through wonderful colleague Samuel, and both of you met in US. Was it last year?
Yes.
For the New England
Biolabs Passion in Science Awards.
Yeah, and I think the award is opened now.
It's currently open.
So, and I'm sure like some people have been asking about applying for the awards, what it looks like, and what you did.
Yeah.
And so both of you got the award. So we'll be having both of you soon to just share some insights on how you applied for the awards and how you got it. So thank you very much for now, Dr. Adewunmi Akingbola.
Right. Thank you very much for having me, for hosting me on the podcast.
Yeah,
thank you very much. Yes,
yeah, see you. So thank you very much. And Next Level Discourse, this is essentially what we do to share tips from people who have won these kind of opportunities. They share from their real life experience what they did, how they positioned themselves, just as you've learned from, I call him Dr. Tesla, how he's gotten these awards. And yes, please make sure to subscribe to our channel for series coming up soon. Thank you. Bye.